Welcome. Good morning, good afternoon, and good evening to all of you who have joined us today from wherever you are. Thank you for being part of the inaugural session of our webinar series hosted by the Georgetown-Lancet Commission on Faith, Trust, and Health. Today's webinar is titled, Can Faith and Science Work Together to Heal the Trust Divide? This moment represents not only the beginning of an important public dialogue, but also the continuation of an urgent global conversation about how trust is formed, how it is fractured, and how it can be rebuilt through new forms of partnership. At a time when societies are experiencing unprecedented polarization, misinformation, and fragmentation, bringing together the moral authority of faith and the empirical strength of science is not only desirable, it is essential. This commission exists because trust has become one of the most fragile yet vital ingredients for achieving better health outcomes, social cohesion, and sustainable well-being. My name is Deus Bazira. I am the director of the Georgetown University Global Health Institute, and I have the privilege of serving as one of the three co-chairs of the commission, alongside Dr. Vinu Aram and Honorable David Beasley. Together with nearly 30 distinguished commissioners, we are committed to reimagining the landscape of trust in health. The commission was formally launched in Istanbul in May 2025, this year that is, but was conceptualized in 2024 as a partnership between the Lancet Group, one of the world's most respected medical journals, and Georgetown University, the oldest Catholic and Jesuit university in the United States. The collaboration reflects a recognition that healing the trust divide between communities and institutions requires merging rigorous scientific thinking with deeply rooted moral, spiritual, and cultural insights. The Georgetown-Lancet Commission was born in the aftermath of multiple global events that revealed profound fractures in trust: pandemics, political polarization, public health missteps, widening inequities, and the rapid spread of digital misinformation. These crises have exposed a central truth. Even the most effective scientific tools cannot protect populations if the people they serve do not trust the institutions or the actors delivering them. The Commission's mandate is ambitious but clear: to generate evidence-informed recommendations for restoring trust, strengthening faith-health partnerships, reshaping public narratives, and grounding future health practice in an ethic of dignity, compassion, transparency, and shared responsibility. To achieve this mandate, the Commission has established 4 thematic areas, each designed to interrogate a different dimension of the intersection of trust, faith, and health, and to build a holistic picture of how faith and health interact across societies. In one of the thematic areas, the Commission will be examining how spirituality, meaning, and existential well-being shape trust in health. It will explore the ways spiritual practices influence mental health, patient-provider relationships, palliative care, resilience, and community healing. It will seek to articulate why spiritual care is not an optional complement to health, but a core component of holistic well-being. Another thematic area will look at how different worldviews, cultural narratives, indigenous knowledge systems, historical experiences, and epistemologies shape how communities interpret evidence, authority, and scientific messages. It asks, why does the same scientific message generate trust in one community and suspicion in another? Importantly, this commission will also focus on the dynamics of institutional collaboration, success factors, failure points, governance models, power imbalances, referral systems, and financial structures. It seeks to understand how trust is built or damaged between government, non-government organizations, healthcare institutions, and faith providers. And finally, the Commission will also analyze how communication networks, formal and informal, shape trust in an era of digital media, algorithmic amplification, and online misinformation. It studies, or will look at, how faith communities engage scientific information online and how digital ecosystems transform perceived authority. The concept of trust is not just a soft one. It's measurable, it's consequential, and determinative of health outcomes. It shapes whether people seek care, adhere to treatment, participate in public health programs, or comply with emergency guidance. It plays a key role in whether health systems can respond effectively during crises and whether communities feel protected or abandoned. For faith communities, trust is the bedrock of pastoral authority, spiritual practice, and social belonging. Faith institutions function on the basis of relational trust, trust that leaders speak truthfully, act compassionately, and honor the dignity of those they serve. For health institutions, trust is the foundation of clinical practice, public health evidence, and system legitimacy. Health systems depend on trust in scientific methodology, provider competence, and institutional accountability. So when trust is present, communities flourish. When trust is broken, health systems falter, misinformation spread, and societies fragment. So it is important to acknowledge that trust itself is not coherently positive. Because faith leaders often hold deep moral authority, their influence can be mobilized for the common good, or could also be misdirected in ways that harm communities. During COVID-19, we saw both possibilities. Many faith leaders played indispensable roles in promoting vaccinations and dispelling misinformation, while a smaller minority, sometimes unintentionally, contributed to conspiracy theories or resistance to life-saving interventions. This dual reality teaches us that trust must be accountable, informed, and rooted in humility and dialogue. Trust is powerful, but not neutral. When grounded in evidence and compassion, it can drive healing. When misdirected, it can amplify harm. This is why sustained partnership between faith and science is essential, not episodic, not crisis-driven, but ongoing, reciprocal, and grounded in shared responsibility. And we've seen this work in the real world. During the Ebola response in West Africa, faith leaders reframed safe burial practices as spiritual acts of love and protection, transforming community resistance into cooperation. During COVID-19 vaccination efforts, Black churches in the United States, mosques across Africa, and Guruduwaras in India served as trusted messengers, increasing vaccine confidence. The HIV/AIDS epidemic has demonstrated that faith health networks delivered stigma-reducing messages and expanded treatment access in areas where government reach was limited. In mental health examples, in Zimbabwe, for example, the Friendship Bench and integrated chaplaincy services have built trust for those reluctant to engage in formal mental health systems. Faith health partnerships in East Africa significantly play an increased role in skilled birth attendance improvement, demonstrating how trust accelerates adoption of essential services. So all these examples point to a central insight. Trust can be rebuilt, and no sector can do it alone. The question before us today is not whether faith and science need each other. The question is how they can work together in sustained, accountable, and mutually respectful ways. Healing trust divide is not a slogan. It is transformative shift in relationships, expectations, and ways of working across faith communities, scientific institutions, and health systems. It challenges us to confront why trust has eroded and what it will take, not episodically, but systematically to rebuild it. And today's panel will explore this question directly. They will help us understand how the lessons from the past can shape the new models of partnership that honor cultural identity, scientific integrity, and community needs. It is now my honor to introduce our panelists for today, Dr. Richard Horton, editor-in-chief of the Lancet, who has been instrumental in the conceptualization and reshaping of this commission, will moderate our panel. Welcome, Dr. Horton. He will be joined by Dr. Adam Rabbit, a physician and a visionary leader in global health, who also happens to be the favorite child of her parents, according to them. And finally, Sister Carol Keehan, former president and chief executive officer, Catholic Health Association of the United States, and a member of the Daughters of Charity of St. Vincent de Paul, and chairperson of the Health Task Force Vatican COVID-19 Commission. You are all welcome, and over to you, Richard. Thank you, all our participants.
Thank you, Deus. That was a beautiful introduction, and I'm really grateful to you and your co-chairs for leading this important and very timely project. We've wanted to explore the relationship between faith and health for some years and have had occasional attempts to do so, but we never quite pulled it off. So I'm really glad that we've been able to establish this commission now. Now, we've got two wonderful guest panelists, and I've got lots of difficult questions for them. And I want to encourage you to submit your questions as an audience too, and then I can put your difficult questions to the panel. But I'm going to start off and ask both of you, Sister Carol and Alla, why now? Why is having this commission in November 2025 and running into 26 and 2027, why do you think it's important to have this commission now? Sister Carol, would you like to have a go at that first?
Thank you, Richard, and thank you for the opportunity to join you today. I think COVID was a worldwide phenomenon that had incredible impacts in every way of life. And we saw the challenges that it did, that effectively confronting it came out of a lack of trust and a suspiciousness and misinformation. It's imperative that we take the time to learn from that, to build from that, to not be unprepared when we have the next worldwide problem. And we have the worldwide problem that it's not like a problem. If I have high cholesterol, that's no biggie on you. But if I have a disease like COVID, it's a biggie on everybody. And so it's imperative from a faith perspective, the faith leaders, and from a science perspective, and the leadership there, that we learn those things. I would say certainly in the United States today, we are struggling with the quality of science and the undermining of trust and confidence in a very special way. So I'll spare you that right now, but I think that's the best I can do for a why we should be doing it.
No, that's great. Thank you very much, Sister Carol. Alla, why now?
I'm going to actually build on what Sister Carol was saying, because I think it's, and I'm going to build on something you said, Richard, which is that you've been wanting to do this for a while. I actually think this is a very long overdue conversation. And I think if we'd had it sooner, we would be so much better prepared for the moment that we're in now. I think we're watching this really wild moment unfold, where for the first time in modern history, the decline in faith in the West has stagnated. We're seeing a resurgence, actually, of faith practice. And I think that the reasoning is because people are kind of sampling practices, beliefs, rituals, or trying to build meaning in a world that feels very chaotic, right? Sister Carol spoke about COVID. You have some of the highest increases in political conflict and violence. You have the use of faith as a political tool in a much more blatant and public way across all aisles in numerous countries. You have a resurgence of autocracy, of climate shocks. And I would say more recently, you have AI rewriting the rules in real time, right? People feel like they're losing a sense of agency. And so when the world moves too fast, humans go instinctively back to the things that make them feel anchored. And I think historically that's been faith, it's been ritual, it's been community, it's been trusted relationships. So this moment feels no different. And I would double click a little bit just for this moment in time in particular. COVID, I think, was an excellent lesson to the health community. I think something that should be even more pronounced is the acceleration of innovation. I think it is messing with a lot of people's sense of certainty, if that makes sense. When you can't tell what's real or fake in a video or a voice note, you cling harder to what is really real, your lived community, your imam, your pastor, your elder, people you see every week. And so I think trust isn't just emotionally important in the way we historically have known it to be, but it's becoming a survival filter for a lot of people in their communities. And that's the last thing I'll touch on. I think community is really attractive. I think people are lonely. People want belonging. They want proximity. They want someone who knows their name and asks about their kids. And I think faith spaces, for all their flaws, they really do provide that. And health systems have often been seen as the exact opposite of that, right? How many times have we joked around about kind of physician bedside manner, et cetera? And so I do think if health systems want to meet people where they are, ignoring faith would be such a massive missed opportunity. And of course, it goes without saying, all of the historical realities. Faith has shaped so much of our laws and norms. It shapes our budgets. I mean, it is so there's all of that. But in this particular moment, November 2025, I think it's an intersecting reality of post-COVID innovation, loneliness, and people really looking for a sense of anchoring. And I think if faith actors want to be very effective and successful, we need to recognize if health actors, want to be successful and effective, we have to recognize the power of faith and community.
Fantastic. That's a great manifesto statement for why we're having the commission. I love it. I mean, if I rewind back to when I got really interested in this, I can remember reading Laudato Si, Pope Francis's encyclical on climate, and I was totally blown away, I've got to say. I thought it was absolutely fantastic that Pope Francis stepped into an extremely controversial debate and showed really courageous leadership. And I remember reading that, getting a copy and reading it. I don't think I've ever read a papal encyclical in my life, but reading that and feeling like, oh my goodness, we're missing something big here. We have to bind ourselves to the faith community much more. And scientists and scientifically trained people often step away from faith communities because it's complicated. And I think if we're going to make this work, we've got to be honest about not just the opportunities, but also some of the tensions. And I wondered if we could explore those opportunities and tensions right at the very beginning and not brush them under the carpet. So, Sister Carol, if I might start with you, I'll have a reflection about what some of those tensions and opportunities might be.
Thank you, Richard. As the person who chaired the health task force for COVID for Pope Francis, it put me right in the center of that. My background is nursing, my background is healthcare management, and at the same time, my background is pretty Catholic. And so you look at that and you looked at the pressure that the faith community was feeling. They have special issues, so that, they have a great care of the vulnerable. They also care a lot about justice in healthcare. They care about not just the people of the Catholic Church, but the vulnerable of the world. And our institutions are largely known for being, wherever they are, open to the care and education of people of all faiths or no faith. But at the same time, they have other special issues that get a hold of them, like abortion. And it came right into the issue of vaccines. Are they made? Are they researched? Are they manufactured using aborted fetuses? So you had their special worries. Then you had our science community who were under enormous pressure with this new disease to be able to say what causes it, how do you cure it, how do you prevent it, in the face of people saying, well, we don't have COVID in our place, and at the same time watching it just go like wildfire. They also had the fact that it is a world health issue. It was threatening the entire world. The faith and science together, though, shared some issues. They both have a lot of challenges that are similar. They have misinformation and disinformation in healthcare and in science and in the faith community. The misinformation and disinformation sometimes you find in healthcare is matched equally with what you can find in faith. And as Alice said, also sometimes both of them have disinformation and misuse of the power of both of them. The distrust, there's often distrust in faith leaders. There's often distrust in science. We see that over and over again. And some of it in certain communities comes from the way science has taken advantage of communities, whether it's been in drug development, testing, or making that person the last person to get the vaccine or the new medicine, and sometimes they have beliefs that may conflict, or that may not be the same priority. So there is no way to get the best of science and the best of faith, which is essential for the best of care and for human flourishing, without confronting that and confronting it with a commitment to resolving it as much as is humanly possible.
Absolutely great reply. Yeah. We have to talk. We have to talk, and even more important, we have to listen. So active listening to one another. Ala, tensions and opportunities, what do you think about those?
I mean, how much time do we have? No. I love that you mentioned the first time that you really looked at this as kind of a glaring issue, because I think it's always so humbling for me, because I have never known a life without it being a reality, right? I was raised by a physician. I am a physician, but I'm also a Muslim woman. And so much of what I was told about my own agency, my own rights, my own norms, for good and bad, has been defined by the understanding, interpretation, and use of faith. And so it's always, I walk into spaces and I'm like, well, don't you see this, this thing that dictates rules and norms, and we're not talking about it. And they're like, what are you talking about? We're following standardized evidence and protocols and timelines. So I think that would be my biggest tension, is perception. I mean, we all so frequently, even the way we talk about it, we say like, okay, health systems operate on these scientific realities, and faith actors are trust and spiritual framing. And I think that's perception, but it's very powerful. And so there's this misalignment, right? Where we're equally trying to influence community to behave in specific ways. We're equally trying to shift understanding. Both communities, I think, have been leveraged for good and bad. I mean, if you look at historical memory in so many communities, particularly those that have experienced colonialism, conflict, or discrimination, health institutions have massive baggage. It was, the French general colonized Morocco, or Hubert Lotley, who said, doctors are more effective at placating a people than soldiers. That's a very powerful statement. And of course, that's true for faith leaders as well. They have manipulated and misused doctrine to their economic and social advantage. And so I think perception, if I had to point to one tension, it is the community's perception of each actor's perception of one another, and their own perception of what makes them superior or kind of more qualified in a particular arena, right? I'm sorry, my son is joining us.
He's very welcome.
We have very different understanding of the way in which people communicate faith generationally. And I think what we are coming up against is a huge generational divide, where we have, because of perception, this assumption that you can't necessarily identify as being somebody of faith unless you are more socially conservative or politically conservative. And I think that's actually going to be a really big problem for us. I think it already is in many countries in the world. And so getting ahead of that will be incredibly important, but it's a tension we should name. And the last tension, I would say, honestly, is money. There is so much money in both of these institutional spaces. And money protects itself, I think, and money is a form of power, and power protects itself. And so within faith communities and within health communities, there is more of a likelihood to hold onto your resources and your power than there is to say, okay, let's do exactly what Sister Carol was saying. Let's listen to each other. Let's co-design. Let's be humble about, what we do know and what we don't know, so that we can stop feeling kind of mutually extractive and start being more collaborative. But those would be three tensions I would really point to.
Yeah, can I, Ala, just come back to it? I hadn't thought about the intergenerational difference. That's really, really interesting. And amazingly, we actually have a question from somebody who's watching that goes to that point. And let me just read it and then let's reflect on it. How should we rethink our engagement strategies to reach younger generations who are simultaneously hyperconnected, mistrustful of institutions, and vulnerable to misinformation? So expand a little bit on that intergenerational point, which I think is really important.
I think the mistrustful of institutions piece is pretty interesting. I would almost put it on its head. Why would they trust these institutions? What have these institutions given this generation? Quite frankly, I'm 35.
Yeah.
I've lived through multiple recessions, more conflict than I can name. I think it's very fair for young people to say, are these institutions acting in service of this generation? So that would be my first point, just on the way that the question was framed, and more susceptible to misinformation, I think, frankly, cuts across generations. I think there's a few things. One, I would actually show up where young people are. I think we tend to have this desire to do a PDF and a press release, and by then we've already lost them, right? There's an element of actually engaging with young people at the co-architecture and co-development space. What Sister Carol was talking about, what you were talking about listening, I mean, that needs to happen across generations more than anything. And then the second thing I would say is, I think young people, and I'm being generous with young because I'm going to say 35 and under for obvious biased reasons. But young people don't necessarily trust institutions. I don't think they've served them well, as I said, but I do think they trust people. I think they trust people who they know. And that is a really important piece. I mean, there's that famous statistic that you're more like the 5 people you're surrounded by, and between, under the age of 50, you're most influenced by your friends and then your colleagues. And I think that's actually really important. And then the other thing, I saw this, I should share it, but there was this thing about if, famous world companies made slogans the way we do in kind of health or development speak. And instead of Nike's "just do it," it was something like "run at a reasonable tempo." You may, like, it was this super long jargony thing. And so I think another element is just like, can we speak human? Can we treat people as co-creators, not as an audience, so that they can really help design that messaging? And then finally, I think, I don't think it's that they are more susceptible to misinformation. I think people are trying to find something to trust, and they're not cynical. Like, we're all overwhelmed. So I think meeting with empathy and humility will be key. And the last thing I'll say, and I say this because me and my own community of particularly Muslim women, but interfaith friends who act as kind of each other's CEO councils, talk about it often, which is, I think we really want real community. Everybody does, right? And so how do you get belonging and information? And I do think that's where faith is very compelling. I think that's where community organizations matter more than ever. We all talk about, like, what's the digital first strategy to get all these young people? And I actually think people tend to go online to validate a belief they now have, not necessarily to create that belief. And so what are they getting offline that gives them a sense of community and a sense of agency? I think will be more important than ever.
Well, I can really see this is going to be a big part of the Commission's work, actually, this intergenerational element. So thank you for exploring that. You mentioned the issue of interfaith. Let me come back to Carol, Sister Carol, because we've had another question on on that very subject. Let me just read this to you, Sister Carol, and then love to get your answer. Does the Commission see ways to have an interfaith dimension that seeks common values and approaches to bring caring to people of diverse faiths? That would promote health and healing directly and an increase in tolerance and peace building indirectly. So have a little bit of a reflection about the interfaith prospects for this work.
Well, I think from the very start, the commission has been designed with people who have different strengths in the science and health area and different strengths in the faith area with different forms and different lines of faith, and also looking at people who claim no faith, but still are deeply spiritual people who have a deep sense of human dignity, etc. And so that was something that I watched the commission people at Georgetown looking very carefully at a balance. And at one point we found what we thought was a slight imbalance and really pushed hard to get someone to fill that slot. So the folks are there, and it's interesting from our first in-person meeting, as well as our Zoom committee meetings, you see that the concerns that I have as an 82-year-old Catholic woman are very closely aligned with the concerns that my 35-year-old dear friend Ella has.
Yes.
But I would say that it is an area, and you at times seen Pope Francis, who went, if you remember some of his travels, he went across from the church to the mosque, signed, mutual pacts, had a deep respect for other faiths and people of no faith. And so I think, and you see that he made the point early on in his papacy very clearly that our world will not be able to live in peace until we come to respect and appreciate people of all faiths. And, as Alla pointed out, we have in many ways failed young people. And I have a longer look at it than a 35-year-old does, but the look is the same thing. I can see the encouraging part for me is I see where there have been successes. It has been when we were really caring about other people, whether you look at people who do wonderful things with a different population or are very clearly outspoken, and even in our universities. We have seen in our universities over the past several generations, college folks who are, we accuse them of being, focused on themselves and blah, 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 blah. But these are the same people who were the most effective in opposing the Vietnam War. These are the same people who forced universities and big sports companies to get out of sweatshops, or at least make huge progress. And then we can look at other various things. So I think there's great promise across generations if we commit to it. And that was one of the things that I saw in the COVID thing. I kept trying to say how important it is to respect people's right to have certain opinions, even if I think that is just so off the page. I can respect you without, I don't have to agree with you because I respect your right. I don't have to, it doesn't imply that I agree with you. And it does imply that I have a much better chance at helping you if you're off a bit on this, or if I'm off a bit on helping us get to a better truth for all of us. And so I would be encouraged about that.
No, that's great. Can I just a quick question from what you just said? You mentioned the word spirituality. Will this commission be looking not just at faiths, but also spirituality? Because there are people who see themselves as having a spiritual dimension, but they might not have a particular faith.
Absolutely. I'm on the spirituality committee, which Deus chairs that committee, and he can tell you just as clearly. we have been very, very adamant that it's not saying, well, you're Muslim, you're
Yeah,
Jewish, you're Protestant, and you're
yeah.
Catholic, and you're Maronite Catholic or a Latin Catholic, and, you know, all the containers we can put ourselves in. Um, uh, there are so many noble, wonderful, loving people who claim no specific faith tradition,
Mm,
but who have a sense of the dignity
mm,
and beauty of
yeah.
other people
Mm,
that put me to shame as a Catholic nun. And you know, so I say over and over again, we don't need to just learn what the Muslim faith dynamics are or what the Jewish
mm,
people want when you're talking to them. We need to come at people with a deep sense of reverence for their
mm,
humanity.
mm.
And sometimes you need to say, if God really wanted them to be Catholic, he'd have made them Catholic. Get off it. You know, so, you know, whatever they are is where they are. And, you know,
Mm.
those kinds of things need to be respected, but
Okay.
respect doesn't necessarily mean you agree with every piece of it.
No.
And you know, most of us who are in the Catholic Church don't agree with every little law somebody has come up with.
Sure.
And so, but I do think that there's so much to be learned and shared, and if we start there, it
Yeah.
helps us as we look across all faith traditions,
Yeah.
or no tradition. I think it's
Great.
imperative, Richard.
That's good. Thank you, Sister Carol. Let me pose the same question, but from Allah's perspective about interfaith. How would you like to respond to that, Allah?
I honestly think, I mean, Sister Carol said it so well. I think if you can start from what our common values are, so compassion,
Yeah.
care, dignity.
Okay.
One
Yeah.
thing I would say really quick on this, though, is we have a tendency, I speak of my own community, but I would say it is true of all faith communities to a degree. And it's also true of the health community in that we really care about something when it impacts us. I mean, we're
Mm,
on like the front lines. We're trying to get it in headlines. Like when it happens to us, we don't have that same level of urgency and action and when it happens to another community. And I think then when suddenly there is something collective, like a health issue or COVID, or then suddenly we're like, well, why isn't the faith community engaged? And so I think there's an element of actually being kind of good to each other and
mm,
engaging each other, even when it isn't a crisis. It is one of the things I'm most excited about, frankly, from this commission, this idea that like there isn't an active, thing happening today where we're all saying this is, but I think one major opportunity is that we get to shift the global narrative. For so
yeah.
long, faith actors have been described as barriers, like barriers to vaccination, barriers to women's health, barriers to modernity, quite frankly.
Mm,
And I think that framing is so like lazy. It's outdated, it's
mm,
lazy, and it's actively harmful. And so I think there's this opportunity for this commission to show how faith partnerships can expand and not necessarily shrink equitable access to health. But there's also the opportunity for us to call in faith communities and say it's
mm,
not selective. You don't get to engage in your values selectively with other communities. This should be
mm,
uniform, regardless of what the other person's practice is. So that would kind of be, I think we all talk about interfaith a lot, and oftentimes, we mean it when we
mm.
are trying to solve a problem. I think interfaith can be a lot more powerful if we just mean it all the time and kind of stand up for each other at all times, because then you always have somebody who's going to have your back too.
Beautifully put. Beautifully put. We've got 4 minutes to go. And what I'd like to do is to look forward a little bit and to get you to think about the opportunities that sit with this commission. This is going to be a piece of work that will go on for a couple of years. We'll aim to report in 2027. But I can tell you now, publication isn't the end. It's just the beginning of the end, because then we need to do something with what the commission is recommending. So it will have an afterlife. What opportunities do you think the commission could seize to make a real impact? Something very tangible, not sort of waffly vision statements, but really, really concrete things. And let me start with Allah, and then we'll go to Sister Carol.
I think so. I think there's a bunch. I mentioned the health narrative. I think
Yeah.
one other thing I'd love for us to see is some practical scalable tools. So like not feel good principles, but actual things that countries can implement, whether that's partnership playbooks, whether that's co-design templates, language guides, getting sensitive issues. And then I think the other thing that I'm really excited about is the opportunity that this somehow influences global financing. We are seeing a dearth of financing, and there are such massive gaps. I started my work at, in a women's rights and security organization in conflict in Libya that leveraged faith and unlocked significant amount of financing through it. About 2 years ago, I created For Mama, which is now called Every Pregnancy, which has built, tens of millions, brought tens of millions into, addressing maternal mortality and child health. And now I'm building multi-million-dollar, $100 million health financing mechanisms through Islamic financing. And so I think there is such a huge volume of financing that we need for communities. There's a huge volume of financing that faith communities actually have access to. And the needs, the mission of the faith community and the health community are one and the same, to ensure that all people lives of dignity and opportunity. So if there's a way that this could be a stepping stone for financing models that really invest in long-term capacity, community health workers, data systems, leadership development in partnership with faith financing, I think it could be really incredible. And it can show governments, multilateral institutions, really everyone, that engaging with faith actors can be a public health multiplier in numerous ways.
I love your ambition. That's fantastic. I think,
Listen, it's why I'm
find
the favorite child, Richard, obviously. I have 10 brothers and sisters. You got to aim high.
Yeah,
You got to aim high.
absolutely. I know. You started with the most difficult one, the financing, but I absolutely let's do it. I always say about Lancet commissions, people have these ideas about utopias, and you can never reach a utopia. But it was John Rawls who talked about, the philosopher who wrote The Theory of Justice, who talked about the idea of a realistic utopia. So that's what the commission is trying to produce, a manifesto for a realistic utopia.
It's when, when they say like a politician is unrealistic with his policy proposals, like that guy's so unrealistic. There's no way to get that. And I'm like, how do you think we got, universal healthcare in Canada? How do you think we got women's right to vote? It was because somebody was unrealistic. Let's be more unrealistic, for crying out loud. We don't always have to go for the common denominator. So yes, I'm all for a realistic utopia.
Good. Sister Carol, opportunities for the commission.
Well,
what do you think?
I certainly hope that I'm going to leave it right now to let Allah solve the money piece of it. And I'll take the other part. Actually, I think finding ways, and this is really a very big task. So I'm glad we didn't try to do it in 6 months. Finding ways to establish something that links us, so that when there is a challenge, I mean, we talk about things like the Abraham Accords that you can deal with, but is there something, and where could it be housed, and where should it be housed, that people could work on in ways that help to continue the journey to linking each other to justice for everyone? I mean, when you look at the world we face, I mean, I do a lot of work in the Middle East right now, primarily in Lebanon and Israel. So it's not for the faint of heart, but I mean, you look at Syria, and I know the people of Syria feel like they have a new chance now. And you look at some of the other countries where the brutality, and you look at, I look at our own country. We worked so hard to get the Obamacare, the ACA going and implemented. And we have now just passed a budget which will put between 17 and 20 million people off of healthcare, who had gotten it. 25 million got healthcare insurance for the first time, and researchers can say their healthcare improved so
Mm,
very much.
mm,
The metrics
mm,
improved.
mm, mm,
But we've just taken action, and we're supposedly the richest country in the world. We've just taken
mm,
action that will walk away. And so when you talk
mm,
about failing each other, that's a great thing. We have to find a way where, and as Ala pointed out earlier, when there is this inhumanity to people, even
mm,
if I can still be quite comfy where I am, but if it's an inhumanity to a section of the world like Gaza or some of the other places, to
yeah,
say this is not right, and uh, or countries responding in ways that are not right.
mm,
We've got to find a way that we keep this, when this commission finishes its actual term, that we have something in place that allows us um, to reconvene or reconnoiter, at least to speak out,
yeah,
and give voice. And also, now, if you think the money is a bad problem, we also need to realize the issue that AI is, or at least try to realize what AI is going to do to mess this
yeah.
up as well. So, um,
Sister Carol, thank you for that. And I mean, I think what you're saying, if I read between the lines, again, we mustn't be shy about confronting very, very difficult, often political, politically charged issues. But we can come at it from a particular perspective, not with a capital P political, but perhaps with a small p, bringing the values, the shared values across the different faiths and spirituality. Listen, we've had the most amazing half an hour of discussion, and we could go on into the night. But I want to thank both of you, our Sister Carol, for your wisdom and your passion and your commitment. And now it's my great pleasure to hand over to Diana Reyes, who's going to tell you a little bit about the next steps. Diana, over to you.
Thank you so much, Richard, and thank you to our wonderful panel. We're so grateful for your expert insights today and to have you represent our commission so well. Richard, thank you for joining us and for moderating this panel. So my name is Diana Reyes. I'm the program director for the Faith and Global Health Initiative here at Georgetown's Global Health Institute, and I'm part of the Secretariat managing the Commission on Faith, Trust, and Health. What you've heard today is just a preview of what the Commission has to offer, both in the breadth of expertise represented by our commissioners like Dr. Ada and Sister Carol, and in the depth of our commitment to understanding how faith, trust, and health interact. We believe that sharing the intentions behind our work with an audience like this is essential to building trust throughout the process. It allows us also to shape our recommendations to be grounded not only in evidence, but also in the experiences and priorities of the communities most affected and most invested in these issues. So I do want to thank our audience as well for their really thoughtful questions, and we'll take note of those that weren't answered. So where are we today with the Commission? The commissioners are fully engaged in the research design and implementation phase of the research. We're putting together case studies and conducting global consultations to inform the report, which will be featured in the Lancet. As Deus touched on in his opening remarks, some of the questions we're exploring include how do people think differently about faith and health, sort of the cultures of knowledge piece, what are good practices within faith health partnerships, some of which you heard today, how can spiritual care be better built into healthcare practice, and lastly, what are the communication spaces, including digital ones, in which faith and health interact. We'll have more opportunities in the future to gather feedback on this work, so please stay tuned for virtual listening sessions around these topics that will be open to the public. And in future sessions of this webinar series, we hope to feature some of our other talented commissioners, including researchers like Professor Tuti Alawa from the Universitas Muhammadiyah Jakarta, Professor Catherine Marshall from Georgetown University, faith leaders like Archbishop Thabo Makoba of Cape Town, policymakers like Nigerian Minister of Health and Social Welfare Muhammad Ali Pate, and others. Those are just a few of our really talented commissioners. And the next topic we'll address after the holidays in January 2026 will focus on mental health, so stay tuned to that. To receive updates on upcoming webinars and other news related to the Commission, please use the link in the chat to sign up for our listserv. And I'll close with handing over to Deus for closing remarks. Thank you all.
And for Sister Carol and Ala for the views you've shared through the panel. I couldn't be prouder on behalf of Georgetown, but also the Institute and health professionals and faith communities all over the world, that this work is going on. I think it's needed. You've all articulated why we need it. And I hope that all of you who are connected today and those who did not join us will stay engaged, because we need all the billions of people in this world who are faith people and those who don't subscribe to any specific religion to be part of this conversation as we explore the way forward. So today we reflected on the centrality of trust, the potential faith-health collaborations, and the urgency of rebuilding relationships in service of human well-being. Our work continues in the months and maybe years ahead through cross-regional consultations, scoping reviews, case studies, and future webinars. But even beyond the publication of our report, actually most of our work will begin then, because we have a lot to do to help rebuild this trust. So we invite you to remain connected, join the conversation, and help us build a world where faith and science can work side by side to heal the trust divide. If we are all connected and we stay committed and engaged, we can heal this divide. Thank you all. Enjoy the weekend.